Imagine this moment. You're at home. Maybe the television is on, maybe you're reading, nothing unusual, and then your body sends a signal you didn't expect. A heavy pressure in your chest. A strange sensation moving into your arm. Your breathing doesn't feel normal. For many older adults, moments like this don't happen in public places. They happen quietly, at home, alone. Each year, hundreds of thousands of Americans experience serious heart-related emergencies while no one else is around. And what surprised researchers wasn't just how often this happens. It was how much the first minute matters. Large European studies have shown that people who understand what to do in the very first moments can dramatically improve their chances of getting through the situation safely. Not because they panic faster, but because they act more calmly and more effectively. What's concerning is this. Most adults over 60 are never clearly taught what those first moments should look like when they're alone. They hesitate, they second-guess themselves, or they do things that feel logical but may not be helpful. Today, I want to walk you through 7 practical, research-informed actions that can make a meaningful difference if something like this ever happens when you're by yourself. This isn't about fear, it's about preparation. And preparation brings confidence. We'll move step by step, starting with the foundation, something that should be in place before anything ever happens. Before we begin, feel free to share your age and where you're watching from in the comments. Many people find comfort realizing they're not alone in learning this. Let's begin. Tip number 7. Prepare your emergency communication setup. This may sound simple, but it's one of the most important steps. During sudden heart-related distress, the brain can become less clear very quickly. Even people who normally speak and think without difficulty may feel confused or disoriented. Research following older adults who experienced cardiac emergencies found that many had trouble remembering basic information in the moment, not because of memory problems, but because the body was under stress. That's why preparation matters. Here's what helps. Write your full address clearly on a card and place it near every phone in your home. Include apartment numbers, gate codes, or anything responders might need. Make emergency calling as easy as possible. One-touch calling is far easier than dialing numbers when coordination feels off. Keep your phone close at night. Many serious events occur during late evening or early morning hours, when phones are often charging in another room. If you live alone, consider a wearable alert device and wear it consistently. Many people own them but remove them during sleep or bathing, which defeats their purpose. If you feel comfortable, let a trusted neighbor know that you live alone and ask them to check in if something seems unusual. In apartment buildings, informing building staff can also help responders reach you faster. These steps don't take long, but they quietly reduce delays when time matters. Tip number 6. Understand controlled coughing and its limits. You may have heard of something called cough CPR. It's often misunderstood. Research shows that in very specific early situations, forceful coughing may help maintain circulation briefly while someone is still fully conscious and waiting for emergency assistance. This is not a replacement for calling for help, and it is not appropriate in all situations. When used correctly and early, studies have shown it may help some people remain alert slightly longer, long enough to call for assistance or move to a safer position. The technique is simple but specific. You take a deep breath, filling your lungs. Then you cough forcefully from deep in your chest. You repeat this rhythm steadily. Inhale deeply, cough strongly. This creates pressure changes in the chest that can support circulation temporarily. What's important is understanding the limit. This is only a short-term support while help is on the way, not a solution on its own. That's why knowing this ahead of time matters. You won't be learning it in the moment. But tip number 5, the aspirin detail many people miss. Most people know aspirin is often mentioned during heart-related emergencies. What fewer people realize is how it's taken can influence how quickly it begins to work. Large studies have shown that aspirin helps by reducing the tendency of blood to clump, which can support blood flow during certain events. One important detail often overlooked: chewing aspirin allows it to be absorbed more quickly than swallowing it whole. This faster absorption can matter in early moments. Keeping non-coated aspirin available and knowing how it's used can be part of preparedness for some people. This is something worth discussing with your own healthcare provider so you know what's appropriate for you personally. Preparation isn't about doing everything. It's about knowing what applies to your situation. Part 2 will cover the body position that supports breathing and circulation. A breathing method shown to reduce strain on the heart, why unlocked doors save lives, and the most time-sensitive action that research consistently highlights. Part 2, tips 4-2. Let's continue with something that often gets overlooked, but can make a real difference while help is on the way. Tip number 4, choose a supportive body position. When the body is under cardiac stress, posture matters more than most people realize. Many assume lying flat is best. In reality, that position can sometimes make breathing more difficult and increase discomfort. Research from European and Asian emergency medicine groups suggests that a semi-upright position may help support circulation and breathing during certain heart-related events. Here's what that looks like. Sit back at about a 45-degree angle. Use a wall, couch, or pillows for support. Keep your knees bent and your feet resting comfortably on the floor or bed. This position can reduce strain on the chest, make breathing feel easier, and help prevent fluid from building up in the lungs. If you begin to feel faint or lightheaded, that's your signal to change position safely. Lower yourself carefully to the floor if needed, using furniture for support. Once on the floor, lying on your side can help keep your airway clear and reduce the chance of discomfort if nausea occurs. Loosen anything tight around your waist, chest, or neck. Even small restrictions can make breathing feel harder during stress. Keep the room cool and well ventilated. Overheating can increase the body's workload at the wrong time. These adjustments don't replace medical care, but they may help your body stay more stable while you're waiting. Tip number 3, use controlled breathing to reduce strain. When people feel sudden chest discomfort or shortness of breath, the natural reaction is to breathe faster. Unfortunately, rapid, shallow breathing can actually make things worse. Studies from major medical centers have shown that slow, controlled breathing can reduce stress on the heart and improve oxygen delivery during critical moments. Here's a simple pattern that's been widely studied. Breathe in slowly through your nose for a count of 4. Pause gently for a count of 4. Then exhale slowly through pursed lips for a count of 6. The longer exhale is important. It helps calm the nervous system and reduces unnecessary strain. Place one hand on your chest and one on your abdomen. Try to feel the lower hand move more than the upper one. That tells you the diaphragm is doing the work, not the chest muscles. This type of breathing has been shown to help lower heart rate, ease tension in blood vessels, and prevent overbreathing. Practicing this when you're calm makes it far easier to use if you ever need it unexpectedly. If you're speaking with emergency services, breathing out loud or counting quietly can also help them understand that you're still responsive. Tip number 2, make access easy for responders. This step saves more time than almost anything else, and many people never think about it. If you're alone and symptoms begin, unlocking your front door early can make a meaningful difference. Emergency responders frequently lose precious minutes when they arrive but can't get inside right away. If you're able, unlock the door as soon as possible and leave it slightly open. Turn on lights to make your home easy to identify, especially at night. If you live in an apartment building, calling building staff or security after contacting emergency services can help guide responders directly to you. Some people choose to use lockboxes or smart locks that allow emergency access. Others place medical information inside the door where it's easily visible. These small decisions reduce confusion during a moment when time matters. In Part 3, we'll cover the most time-sensitive action on this list, how certain medications are used correctly during emergencies, and how preparation today can change outcomes tomorrow. Tip number 1. Follow the emergency nitroglycerin protocol if prescribed. This final step is the most time-sensitive one on the list, and also the most misunderstood. Large clinical reviews have shown that when nitroglycerin is used correctly and early, it can significantly reduce strain on the heart in certain situations. But timing and technique matter. First, an important clarification. Nitroglycerin is not for everyone. It should only be used if it has already been prescribed to you by your healthcare provider and you've been instructed on its use. If you have it available, here's what matters. At the very first sign of serious chest pressure or tightness, sit down immediately. Never use nitroglycerin while standing, because it can cause a sudden drop in blood pressure. Place one tablet under your tongue, not on top of it. Do not chew or swallow it. Let it dissolve naturally. Most people notice a mild tingling or warmth. That's expected. Wait 5 minutes. If symptoms do not ease, a second tablet may be used according to standard guidance. After another 5 minutes, a third may be used if needed. Do not exceed the recommended amount. Proper storage matters more than many realize. Nitroglycerin is sensitive to heat, light, and air. It should be kept in its original container and replaced regularly, even if unused. One more critical note. Certain medications should not be combined with nitroglycerin. If you take medications for circulation or blood pressure, this should already be discussed with your healthcare provider in advance. Preparation is what makes this step effective, not panic in the moment. Why preparation matters more than reaction. What all 7 of these steps have in common is simple. They work best when you already know them. In moments of physical stress, thinking clearly becomes harder. That's why preparation done calmly, ahead of time, is so powerful. Knowing where your phone is, keeping doors accessible, practicing calm breathing, having medications organized, understanding what actions help and which don't. None of these require strength, speed, or special equipment. They require awareness. A calm reminder. These steps are not meant to replace medical care. They are meant to support your body while help is on the way. Response times vary. What you do in the first few minutes can influence how stable you remain until assistance arrives. And this information isn't just for you. Sharing it with family, friends, or neighbors can help others feel more prepared as well. Closing. If this video helped you feel more informed or confident, take a moment to think about your own setup at home. Is your phone easy to reach at night? Would responders be able to enter quickly if needed? Do you feel comfortable with the steps you'd take first? Many people quietly wonder these things but never talk about them. If you're comfortable, share your thoughts or experiences in the comments. Your perspective may help someone else feel less alone. Thank you for spending this time with me.